This segment is brought to you in part by UnitedHealthcare.
We've seen millennial preferences and buying habits differ sharply from their boomer and Gen X predecessors. And now we're seeing it in healthcare, too. UnitedHealthcare and Health Action Council recently released a report on the health of millennials. The report surprisingly reveals that adults aged 27 through 42 depend more on the healthcare system and experience significantly more chronic health conditions compared to Gen X or baby boomers. To help explain the report findings, I'm joined today by Craig Kurtzweil, Vice President with the UnitedHealthcare Center for Advanced Analytics, and Patty Starr, Health Action Council CEO. It is great to have you both with us this morning.
Thank you.
Thanks for having us.
Craig, let's start with you. What did you learn from studying millennials and their children?
We are in the healthcare space starting to see that millennials use the healthcare system in a very different way. For example, we see that millennials are using the ER, urgent care, and virtual care at levels we've never seen before in any generation prior to them. They also are choosing not to use brick and mortar primary care physicians in the way that we typically have seen with prior generations.
So what are the causes and the implications of all of this?
I think it has wide-ranging effects across the healthcare system. If they're not willing to engage in the older-fashioned sort of view of a primary care model, how do we make sure we can engage them and meet them where they're at so that we can transition virtual care, for example, to not just managing cold and flu and COVID, but changing into a model that can actually help these millennials manage their growing chronic disease prevalence.
And to add to that, Craig, what about mental health needs? Where do millennials stack up there?
We see more than double the rate of behavioral health claims within the millennial generation than we do within the baby boomer generation. And a lot of that is due, again, to stigma. Baby boomers likely have issues, just it was a different generation and it's much harder to receive care due to some of that stigma.
So, Patty, what are the solutions to improving the health for millennials?
There's a great opportunity for employers to really step in at this point in time. They don't really have a good idea of what's happening with their at-well people or at-risk people. So a focus needs to happen on those that are at high risk. The second thing that they can do is implement and promote disease prevention or lifestyle modification within their population. Another great opportunity is in education. So really making sure that they know when to get care and where to get care is a great education opportunity.
Excellent. Thank you both for joining us this morning. Again, if our viewers would like more information on this study, where should they go?
They can come to the Health Action Council website at healthactioncouncil.org, and the full report is available there.
And you know, what's so interesting about this study is that the millennials, who some of them are now in their 40s, they're revolutionizing the medical industry. They're encountering aging diseases like diabetes and so much more. And they're saying, we don't want to be treated like our parents. And the fact that the medical industry is meeting them where they are is changing the healthcare industry. And after I spoke to these folks over at UHC, it reminded me that I look at like my nieces and my nephews who are the tail ends of the millennials and the Gen Zers, and they're like, we want preventative medicine. We don't want to end up in the doctor's office when we're like on death's door.
Exactly. Do everything you can now.
Right? Be preventative. I like that.
Amen.
Business.